Good morning for those in Brazil. Good afternoon for those in Europe. I'm José Pio Borges, Chairman of the Board of Trustees of CEBRI, and it's a great pleasure to welcome you to today's webinar in a partnership between CEBRI and the European Union Delegation in Brazil. CEBRI has a long-lasting partnership with the delegation, and we have co-organized with the Konrad Adenauer Foundation, the Forte Copacabana International Security Conference for almost 20 years, an event that fosters the dialogue between Europe and Latin America and promotes reflections on and cooperation between Europe and Latin America. In 2021, we have developed with our friends Inácio and Domenica a second project with the European Union, which is the Multilateralism program, and the delegation started the project Economic Political Realignments, European Contributions. So, in a joint project between CEBRI and the European Union delegation, our relationship gets even closer in the promotion of reflections and changes in the international system, as well as the construction of solutions to issues that affect Brazil and the European countries. It aims to analyze and develop proposals on the political and economic challenges of the current international order, based on the visions and contributions of the European Union and Brazil. Of course, when we developed this project, we have no idea that the Ukrainian war would break out and being the most important conflict since the Second War in Europe. And this precipitates a lot of changes that we're trying to envisage, and creates developments and questions such as what's going to be the new geopolitical scenario, what's going to happen with the supply chain and globalization. Is globalization gone too far? What's going to happen with the energy transition and the environmental challenges? What's going to happen with the system of payments that after all the sanctions and all of that? So the challenges are much greater now, and I believe that the changes that we were trying to foresee are going to happen much faster than before. So this webinar is part of this project and focuses on the strategic autonomy of European foreign policy. This is, again, a big challenge now. What's going to be the role of Europe in the negotiations, in the diplomatic negotiations for peace in this conflict between Europe and Ukraine and Russia? So the objective of this event is to discuss how national sovereignty policies fit into multilateral regulatory practices and how to reconcile the different visions of European countries with the promotion of supranational collective policy in order to strengthen and consolidate the European narrative for foreign policy issues. In addition to today's event, in 2022, there will be 3 other webinars that will address topics of trade and transformations in international political economy, Green Deal, sustainable development and technological innovation, and consensus building and norms of multilateral policy. Of course, there are other issues that will arise from the conflict in Ukraine, which eventually we're going to have to adjust our initial program to comply with that. So to continue this opening session, I pass the floor to my friend Inácio Ibanez, Ambassador of the European Union in Brazil. Ambassador, please.
Muito obrigado, Pio. Bom dia, Brazil. Good afternoon, Europe. It's really a pleasure to be here with all of you. I would like to start my initial remarks by thanking CEBRI, today very well represented by Pio Borges, but also by Carlos Milani, for supporting and organizing this webinar as part of our joint project, Economic and Political Realignments, European Contributions. This project is our joint endeavor to uphold multilateralism, dialogue, and peace as the only way forward to face ever new global challenges for humanity. I would also like to express my sincere gratitude to our distinguished speakers, Valeria Fargion, Marco Mayer, to share with us all their valuable experience at a time when disruptive dynamics in the international arena call more than ever for a strategic autonomy to safeguard our interest, uphold our democratic values, peace and rule of law, and help shape the global future together. The unprovoked and unjustified military aggression perpetrated by Russia against Ukraine has brought a full-fledged war back in Europe, directly on our borders, in a flagrant violation of international law and the core principles on which the international rules-based order is built. It has also turned into the most serious assault on the post-Cold War security architecture in Europe and in the whole world. In response to the blatant attempt to rewrite the rules of our international system, the European Union has shown an unprecedented unity and strength. We have imposed on Russia the strictest sanctions ever adopted. The European Union and its member states are providing coordinating humanitarian, political, financial, and material support to Ukraine. Member states are also showing immense solidarity in hosting countless people, mostly women, children, and elderly, fleeing the war. In all relevant multilateral fora, the European Union, together with transatlantic and like-minded partners, such as Brazil, have been united in their untiring efforts to achieve a diplomatic solution to the security crisis caused by Russia, which endangers international peace and security at a global scale. We will continue reinforcing our common stance, not only to show our staunch support to Ukraine, its sovereignty, its territorial integrity, and its democracy, but also, and above all, to promote and defend the fundamental rights, universal values, and international law that form the bedrock of cooperative relations between countries and peoples. Over the past few years, faced with multiple crises and challenges, the European Union and its member states engaged together on an ambitious strategic agenda. In the light of recent events, it is more urgent than ever that we take decisive steps towards bolstering our economic strength and social cohesion, building a credible and robust security and defense autonomy, and reinforcing our global position. Even before the current security crisis, the COVID-19 pandemic had already created much-needed momentum for a coordinated global crisis response. The European Union has worked tirelessly to ensure higher, sustained, and long-term political engagement of the international community to enable countries around the globe to strengthen national, regional, and global capacities and resilience to the socioeconomic impacts of COVID-19. Since the outbreak of COVID-19, the European Union and its member states have been acting together, guided by the principle of solidarity and multilateralism, to provide support to partners around the world and secure significant funding to counteract the pandemic's disruptive consequences on a global scale, including to ensure universal access to vaccine, because, as we say, no one is safe until everyone is safe. Team Europe is one of the lead donors of COVAX facility and remains on track to deliver its commitment to donate at least 700 million doses by mid-2022 to support the goal of getting 70% of the global population vaccinated. Additionally, Team Europe has been assisting partner countries around the world with financial and humanitarian support for countries in need, while working at multilateral level for an international treaty to improve pandemic preparedness and response in the wake of COVID-19 for the sake of future generations. As part of the decisive actions taken to protect our societies from what could have been the worst economic crisis since the Great Depression, the European Union designed an unprecedented 2,364 billion support to its member states to allow them moving away from managing the crisis to consolidating a sustainable, innovative, and inclusive recovery. In this context, our recovery from the COVID fallout will provide a unique opportunity for transformation and innovation, an opportunity for the innovative retooling needed to thrive in the digital post-pandemic world and to make peace with our planet by switching to a carbon-neutral growth paradigm. EU leadership in addressing the green and digital transition is a clear expression of our strategic autonomy, which is about much more than defense and security. Our security and defense does not exist in a vacuum, but both remains intrinsically linked to our twin transitions, climate and digital, which have become critical for the European Union to affirm its position as a credible and efficient global security provider and a soft geopolitical influencer. However, managing this transition will be a difficult challenge from both a competition and a geopolitical point of view. Succeeding in these transitions will require a paradigm shift, switching from the overexploitation of natural resources to a sustainable circular economy and maximizing the vast potential of digital resources while protecting the safety and privacy of our citizens. The climate and digital transitions also require efficient regulation, a domain where the European Union has the capacity to influence global norms, open standards that reflect our democratic values and our focus on citizens' well-being and safety. Being strong on security and defense means being strong on research and development. That means boosting our support for a competitive European defense industrial and technological base. The upcoming roadmap on critical technologies in security and defense will help to guide our efforts, as will the action plan on synergies between the civil, space, and defense industries. By linking our policies and tools and working more closely across sectors, we can and will maximize our impact and achieve our strategic objectives. The European Union has a powerful hand to play across our external relation, including as a loyal and a capable security and defense partner. Against the backdrop of growing security challenges, the debate regarding the future of European defense cooperation has grown in relevance. While the Lisbon Treaty introduced significant possibilities with regard to the future of EU defense policy, and while there has been consistent EU member states' public support for further cooperation in this area, progress has been slow. The impact of the economic crisis on defense budgets, fears concerning the effects of more integration on national defense industries, and various political considerations are some of the reasons that have been given to explain the reluctance to move towards closer cooperation in defense until now. Much has been said in recent months on the security and defense dimension of the European Union's strategic sovereignty, and the current crisis with Russia has only confirmed the need for undisputable shifts in our security environment. First, NATO remains the backbone of European defense, and Russia's attempt to divide has only reinforced the unity of the alliance. Second, strong partners make strong allies. That is why the European Union and its member states are trying to strengthen our capabilities. We are now In the process of agreeing our European strategic compass proposed by the High Representative Borrell, and in late March, we will have an important summit in Brussels on these important questions. We are also preparing a new EU-NATO statement that should be adopted very soon. In their informal meetings last week in Versailles, the 10th and 11th of March, the European Union leaders adopted the Versailles Declaration that outlines how the EU can live up to this responsibility and protect EU citizens, values, and democracy, and the European model. They reaffirm their commitment to take more responsibility for the EU's own security, pursue a strategic course of action in defense, and increase its capacity to act autonomously, building on the conclusion of the European Council meeting of December 2021. The leaders stress that continued strong coordination on security and defense with partners and allies is key in this respect, including EU-NATO cooperation and the principles of EU treaties on inclusiveness, reciprocity, and decision-making autonomy. In parallel, the European Union will continue to support partners through foreign policy instruments, notably the Enhanced European Peace Facility and the forthcoming Strategic Compass that will provide guidance on how to make the EU a stronger and more capable security provider. I would like to end my intervention by saying a few words on what is perhaps the major challenges for our democracies around the world, which is certainly not just about mobilizing military assets or security alliance. The Russia-Ukraine crisis highlights what we have been seeing for years now, an increasing pressure which sometimes comes from within, often from outside, on democratic institutions, on the rule of law, on freedom, and on the principles of trust and transparency. It is certainly a historic moral responsibility for the European Union to engage with its like-minded partners, such as Brazil, to defend universal principles and the multilateral acquis, especially with regards to democracy, human rights, and the rule of law, and tackle the challenges raised by the methods of authoritarian regimes which do not respect the international law and decided to use not only military force, but also hybrid force through cyber attacks, and which attack us, our friends, and our partners. Thank you very much.
Thank you, Inácio. Now to moderate this event, I will invite Carlos Milani, Senior Fellow of CEBRI's Multilateralism Program and Vice Director of the Institute of Social and Political Studies of the State University of Rio de Janeiro. And Carlos will introduce the panelists that will participate. Thank you.
Good morning, everyone. It's a pleasure to be here with you. Good afternoon over there in Europe. My name is Carlos Milani, as Pio Borges said. It's a pleasure to be here with Ambassador Ibanez, too. In order to address the main topic of today's session, which is strategic autonomy in European foreign policy, we are going to focus today on three issues, which are COVID-19, communitarian policies, and health diplomacy. And in order to discuss these topics with us today, we have two very prestigious panelists, both from Italy. We are going to kick off with Valeria Farjon, who holds the Jean Monnet Chair on the Politics of European Integration at the School of Political Science, University of Florence, Firenze, where she also served as Head of International Relations and Coordinator of the European Studies track in the RISE Master Program. Valeria has published extensively on comparative social policy, the Italian welfare state, territorial politics, and EU development cooperation with Africa. She recently edited with Mamadou Gazebo, Revisiting EU-Africa Relations in a Changing World, published by Elgar in September 2021. And after Valeria Farjon, we are going to listen to Marco Maier, who is the former special advisor on cybersecurity to the Italian Minister of Home Affairs. He is also an adjunct professor of international cyber politics, cybersecurity master, Louis University. And he's a member of the UN Security Council roster of experts and on sanctions. And he has also served the UN peacekeeping mission in Kosovo between 1999 and 2002. He has been minister for the regional government of Tuscany and member of the Italian Trade Commission Executive Board. It's a great pleasure, Valeria and Marco, to have you on board today. You will have each of you around 10-15 minutes maximum to address these challenging issues. I know it's an enormous challenge to do that in 10 minutes. When we get to 10 minutes, as a moderator, I have this very unpleasant role to just call your attention for the time. Valeria, please, you have the floor. Thank you.
Well, first of all, thank you so much for the invitation. Actually, I was positively surprised by Brazilian interest in what the EU is doing in Africa. To be honest, my heart and my mind are on the eastern border of Europe right now. Although I have actually been working on EU-Africa relations for almost 15 years, so it's kind of strange to speak about EU-Africa today with the situation that we're going through right now in Ukraine. Nevertheless, I will try to do this at my best. I will first of all try to briefly sketch out the situation before the outbreak of COVID-19, and then speak on what the EU has been doing after the outbreak of the pandemic. So I will now present in the first part of my presentation. I will try to be as brief as possible, but I will be using some tables and figures from the book that you just mentioned, Revisiting EU-Africa Relations in a Changing World, and in particular from the chapter that is devoted precisely to EU development cooperation with Africa. And that chapter I wrote with my husband. Let's see if I can share, just a second. Can you see it?
Yes.
Is it okay?
Yes, it's okay.
It's okay. Okay, so I must be honest and say that this is a sort of a critical approach to the issue. I wouldn't want to be critical today because I think that the current situation is bringing the European member states closer together in order to address global challenges. But since I have been asked to reflect in particular on the position of the EU on global health issues, I'm afraid my comments will be rather critical. First of all, background information on the EU's engagement in global health. In this table, what you see is the contribution of various United States, China, but
Valeria,
also
you have to change the slides, please.
I can see this one now. Can you see that?
We are not on the table yet.
Why? Because I can see it. Saying condivisione schermo. This tells me that I am sharing.
We can see the screen, but it's still on the first page of your PowerPoint.
But it's strange because I can see the second page, and then now I'm seeing the third. What can I do?
Just keep on. That's my advice.
Yeah, but it would be important for you to see the figures, and you don't see them, what I get. Should I send my PowerPoint to Vittoria? Well, I don't know what to do, because
Yes. I think it's better if you send the PowerPoint to Vittoria then.
I'm sorry. We tried it out, and it was working. I don't know what's happened, but just 1 minute and I'll try to send it. Just 1 minute.
Try to share it again. Perhaps it will work out.
But I'm sending it to Victoria. Is that right? Just in case.
You can try to share it now. Let's see if it works.
They changed some. But 1 minute because
No
I have
problem.
to upload it to send it over. Just please excuse me. Just 1 minute. I should have sent it before, but it worked when we gave it with practice, and it seemed as it was working. Let me just 1 minute. COVID, no, getting mixed up. Sorry. I'll speak as I'm trying to send my PowerPoint. The message I want to give is that the EU between the year 2000 and the year 2018 decreased commitments towards global health. So this is the first I'm sending. This is the first message from. I'm sending it to Victoria. Okay, in via senza. There's no. I'm just sending the PowerPoint. Okay, I'm back. Let's hope. Mannaggia.
Our colleagues here, Valeria, are saying that you can try to share the screen again. Perhaps it
Try
will
it
work.
again.
Yes, please.
Yes, but now I'm out. I seem to be out of the. I don't know why. I'm not in the. I'm no longer. Get started. Why?
We can see you perfectly and we can hear you perfectly.
Yeah, but I can't see anything anymore. This is a mess. Shall I restart the
Restart, yes.
I don't know what to do.
You have to restart, Valeria.
We have the PowerPoint here and we are going to share the screen here. Don't worry.
Okay, but I need to restart because I can't. Because I can't see anything anymore.
We can see you and we can hear you, and we already have the slides here to show. I can tell you.
What do I do? I just speak.
Yes, go on. Just speak, and we are going to share the slide with the table that you were mentioning.
Okay, so but I have to open it myself because otherwise I won't be able to comment on it. Just 1 minute. So my first message is that whereas in the United States from the year 2000 to the year 2018, the percentage of the contribution by the US for global health issues went up from 13 to 17%. As far as the EU Commission and member states are concerned, considering both together, unfortunately, the contribution went down from 14, almost 15%, down to 8%. Can you see that? Okay. So there is a decrease in the EU's commitment with respect to global health issues, whereas there is a major increase when it comes to NGOs, foundations, that goes up to 28% over this time period. Now, next slide, please. Can you see it? Forgetting about health in EU development cooperation with sub-Saharan Africa. Can you see that? Can you see it? Can you confirm?
Hi, Valeria. Yes, we are getting the presentation up on the screen now. Just one more moment, please.
I'm back.
Yes, we can see it now.
Yeah, but I can't see the presentation for some reason. Impossibile condividere lo schermo. Okay, you were doing it. I'm sorry for this technical problem.
We are showing the presentation for you.
Okay.
So right now it's on the page that says Health ODA by Donor 2018 that starts with the United States.
Yeah, okay. I've already commented on that.
Next one. Okay.
Can you go on? Next one?
Okay, it's on a chart. Which page should we move up to?
No, go down, just follow, because unfortunately now I can't, I have to imagine what's on my slides because I can't see them.
Now, mechanism activations by hazard type 2007 to 2021. Should we continue on?
No, the second slide. Just go on to the, I commented on the first one. You need to go on to the second one.
Okay.
Yes.
Okay, we're back on the budget support now. Report.
No. Okay, now there is, I will just try to work it out. The third slide tells you the priorities that were decided by the EU and sub-Saharan countries. And as you can see, it was only between the period 2007, 2013, and then 2014, 2020, okay? And you can see that only very few countries prioritized health. Can you see that? Only 4 and then 12 and then, okay. No, I can't, I don't know how to do this because I can't see anything and I'm sorry, I just don't know what to do.
Okay, right now we are on the health ODA by donor slide that starts with the United States.
But I've already commented on that. Go down.
This is the third. So next is the forgetting about health. And after
Okay.
that, the health ODA European Commission
What?
chart.
Okay. Health ODA European Commission, what you see here is that the EU only spent about 200 million each year in those years. That's before the outbreak of the pandemic, which is very little. Member states altogether spend definitely more. So that what I'm arguing is that unfortunately, the engagement of the Commission on health issues was not so relevant, okay, not so considerable. You can go ahead. And the UK, which is no longer part of the EC, was in fact a member state that was very engaged in supporting healthcare and the development of healthcare systems in Africa. The next one, please.
Okay, EU emergency support now is showing.
Okay, what happened? So my basic point is that unfortunately, before the outbreak of COVID, there was no great engagement by the EU specifically on supporting healthcare in Africa, despite the fact that Africa is the part of the world where health conditions are the worst. With the outbreak of the pandemic, what you can see is that, in fact, there is an interest of the EU, and especially towards the neighboring countries, the neighborhood. And that's clearly understandable because it's the countries right next to us. Can you go on to the next one? Can you tell me what?
It's on the EU emergency support slide now.
Okay, now, as the ambassador said, actually the EU has invested money in trying to support other countries in order for them to address the issues caused by the pandemic, by the COVID pandemic. But nevertheless, what I want you to focus on is the fact that you can see it from that table, that the bulk of the money went for recovering the economic consequences of the pandemic, not for strictly supporting health systems. You can see the difference in the figures. Much more money for addressing the economic consequences, far less for actually addressing directly health issues. Can you go on to the next one?
Now, COVID-19, 3 billion EU assistance package slide.
Yeah, that I've already said, it's in the neighborhood. More money going to the neighborhood. The next one.
Next on to Team Europe.
Yeah, that's what I was arguing. Sorry, then I got it inverted. Here you can see that most of the money was going to for the economic consequences. That's a right-hand column, which tells you that more money was going to support economic consequences rather than the strictly supporting the health systems. Yes, you can go ahead.
Next is towards a comprehensive strategy with Africa.
Yes, and this tells you which were the priorities of the EU when in March 2020, when the pandemic broke out. That, as you can see, you reading through the list, health is not on the list. And let me tell you that I was hoping that with the Ebola, which was in 2015, the EU would realize that health is an important issue, but that didn't happen. And as you can see here in March 2020, health is still not an issue. I'm not saying that the EU is not investing money. I'm saying that health has never been a priority, not even with the COVID, unfortunately. It is starting now to be a priority. Can you go on to the next?
It's on the next slide now.
Yes, go on.
Share of people fully vaccinated against COVID against share of people only partly vaccinated. Slide.
Share of people vaccinated, not only over partly. The first map that you see of Africa, this is very important because we keep saying that we're sending vaccines. Yes, we are, but to a very limited extent, because as you can see, most on the map, most of African countries are, in terms of the shade, white or pale blue, which means under 10% of the people are vaccinated. In some cases, less than 30, but very, very few. It's like 5 countries where the share of people that are vaccinated is relatively high. And these countries are Egypt, Morocco, Tunisia, Mauritius, Capo Verde, the Seychelles, these few islands and those 3 countries, and Botswana. But the next one is even more important. Next map, which is, so the other one was in green, this must be in blue, I think. This tells you—
This is the green map.
Yes, the
green.
On
now.
No, the share of vaccines actually administered. This is a very important message, and this is the thrust of my presentation. We should not be concentrating on sending vaccines as if that is the solution, because the great problem is that if you send the vaccines, but you're unable to administer the vaccines, it is useless to send the vaccines. So the message is that you need to strengthen healthcare systems, because here you see that many countries are actually administering less than 30% of the vaccines that are available, and the number of vaccines, the doses that are available are extremely limited. And nevertheless, the percentage of the ones that are actually administered are even lower. Now, so I'm getting really to the end of my argument, even if, I mean, I'm terribly sorry, but not seeing my slides is kind of difficult. What is actually happening is that the EU, in line with this idea that you're supposed to promote and enhance private-public investment, is actually focusing especially on manufacturing of vaccines in Africa. This is the sort of the leading idea. We should help Africa to manufacture its own vaccines. To be honest, if you look at 2 recent seminars that have been organized by the EU with the pharmaceutical industry, what even the director of the World Health Organization is saying in one of the, for the region of Africa, what she's saying is, Mutsuido Moeti, that's her name, a dependable pipeline must go hand in hand with operational funding to move doses out of depots and into people's arms. And a similar, which means, again, you need to have a working system. And again, if you listen in the EU-Africa Business Forum, 14 February, Karim Benahu said, she's head of Africa Merck. She said, even if you have factories, you need healthcare systems. So my point is that we should be focusing more as the European Union on strengthening healthcare system, because if we really believe that no one is safe unless everyone is safe, then in order to make this true, we must try to strengthen health systems. This is a priority. If you read the multi-annual, this is my final note, if you read the multi-annual indicative program, you can find that priority area 1 is human development and health is there. But you can also read in the document by the European Union, joint programming is not feasible from a regional perspective since EU member states mainly focus their bilateral cooperation at the country level according to their respective external priorities. I don't know if the Ukrainian war is the final thing that will make us understand that we need to have a coordinated external policy, that we cannot go each one its own way. We need to coordinate our action. And there is some hope if you look at the 48 national indicative programs that have been agreed by the European Union with individual African states. And that was the last table on my presentation. You will see that there are 15 countries that have signed agreements for supporting health. But it's 15, actually, to be honest, it's 16. There's one that is focusing on only on reproductive health. But it's 15 out of 48 sub-Saharan countries. So what I'm saying is that still not enough. I don't know if we need another pandemic before the EU realizes that it has to concentrate on strengthening national healthcare system. But why isn't it doing so? Because we can't forget about the fact that in Africa, most of the governments are in fact illiberal, autocratic governments that are not that interested in the conditions of the population at large. And when the leaders in these governments are sick, what do? They go out to, they go to London, or they go to private clinics in Nairobi. So they're not so worried about what? About the conditions of the population in general that is unable to go to London to be cured if they're sick. So I understand that my position is a strong position, but I'm not arguing about throwing money down the drain. I'm arguing about strengthening national healthcare systems. And this is what we need to be doing, not simply focusing on having manufacturing of vaccines in Africa. Because as the two quotations I gave you come from leaders in the health system, and they're saying, okay, we've got vaccines, but we need to be able to administer the vaccines, and you're not going to be able to administer vaccines unless you have a working system. Sorry, this is the end of it. I'm terribly sorry for the difficulties. I don't know what happened, but it is kind of difficult to comment on tables that you don't see.
Thank you, grazie, Valeria. I know it was technically difficult, but your message is clear and strong, and we got your message. Okay. I'm going to give the floor to Marco Meyer to make his presentation, and then we can kick off with the debate. Right?
Yes, I have to give him my position because his computer is not working, so he's going to sit at my place now.
Okay, thank you.
So luckily enough, I don't have any PPTs to show, but I did send to Victoria some links. I don't know if she was able to show them to you or not, but in any case,
she shared them with us. Thank you, Dr. Marco Meyer. She did, yes.
Okay, so that's something that may be useful for the 60 people who are joining the seminar. So in my short presentation, I would like to give, to build up on my wife Valeria's strong position, which is that the European Union has not worked as it should on the strengthening of the health system, but also to give a substantial significance to the word autonomy, you know, the EU autonomous strategy, or whatever you want to call it. Sometimes they call it autonomy, sovereignty, and so on. The key point is this one. Usually, Europe doesn't pay enough attention to what happens at the global level. You can understand that because it's not easy at all to get an agreement between 27 nations, countries, governments, and so on. But it is very clear that if Europe doesn't study deeply what the other world player are actually doing, the risk is very big because Europe doesn't catch up what's going on in the world, which unfortunately has happened many times. In my links, as you have seen, I start for quotation of Gandhi, who says that health is more than silver and more than gold. And this is not a rhetoric assumption. You must think that India is very active on both sides. On one side, it's more very active for vaccines and pharmaceutical industrial at low cost. And sometimes there's also what it's called an unfair competition. But this is a big question to be addressed in order to find, as you will see in the links, new agreements between India, Africa, and the EU even on how to get, I think the South African case is one of the most interesting. So you have a problem of competition, you have a huge problem of patents, and then you have also a problem which involves China, India, and other Asian countries of the very dangerous fake medicines that are in the dark web. So the first thing, India. So I would suggest that Brussels looks at India and what they are doing in India, if they can do something together with India, or even perhaps stop the wrong doing of India. But this is a very crucial point, which is underestimated a lot at the moment. The second point that you will find in the links I showed is China. China is now in a difficult position because they believed a lot in BRICS, Brazil, Russia, China, India, and South Africa. No, you know this very well. Now, BRICS doesn't exist anymore in terms of political unity because India is against China, China is supporting 50% of Russian behavior. It's a very confusing. So Europe should understand what is China politics in Africa and try to counterbalance the wrong parts of China, which are mainly two, besides the fake, which is another problem of a big problem. The first point is that China use Africa as a kind of financial bucket. What do? They give credits, and this is useful because obviously the credits underscore the significance of the financial role of China. But then there is, as you know much better than me, the so-called debt trap. So you have many African countries who are unable to pay the interest, and then they're looking for different channels. And at this moment, China is in some economic difficulties, so they would like the money back, and African countries are looking for help abroad. So it's a big opportunity for India, for Europe, for many parts of the world. And obviously, going back to the health system, this is another very, very significant position. The second point is that China exports to Africa not only goods, equipment, technology, they export management and skill professional. So practically, I don't say, I mean, perhaps it's too much to say that it's Africa is some African countries are Chinese colonies. That's too strong, perhaps. But the mind, the brain, the knowledge is mainly Chinese. So China gets a lot of, it's an opportunity for Chinese elite to work, but much less for African people. The third point, but Valeria already told you that, is that they don't care at all of what's going on the ground. So if you have huge crimes or war crimes or human rights, whatever, I mean, they just do what they want. So this is another factor that you should consider. My last comparison very quickly are on Russia and Turkey, and obviously the US. Well, as you will see from the links I pointed out for the seminar, you had since this 24th of February, both Russia and both Turkey strongly engaged in a new African partnership. Russia with the Wagner mercenaries and also with their military bases. You must understand, that the Soviet Union used to have Angola, Mozambique, Ethiopia, many, Libya, and so on. So they were restarting that. And in this case, what I suggest as for further research is the special link between Russia and South Africa. Because it's true, as I said before, that there is interesting Indian and South African linkage in terms of health, but there is also something strange on militaries between Moscow and South Africa. So I mean, this is something that we should look at. Turkey is a little bit the same in the sense that Turkey is an old empire that is trying to have a sort of a renaissance, to have a bigger influence. And so they are very active also in the health system. As far as you know, the United States have had a vertical approach because it started with the HPV problem, AIDS. And so we had the first fund and then the 3 disease fund, but it was all vertical, or not horizontal. So it means they were working on single disease, communicable disease, but not on the systems. A big example of this, of a good American experience in Africa is Liberia, because they had a very strong liaison between civil and military, and there was many thousands of Marines on the, I mean, health doctors, and not I mean, they were military, but of the health sector. And I think that Liberia experience is certainly something to be looked at as an interesting experience. Now, the question is that the United States have a private system, even if Obama has, with the Obamacare. So I think that at the end, what Valeria was saying before, we don't understand why Europe, that has a proper welfare, good national health system, doesn't choose health diplomacy and health cooperation as the absolute priority. Sometimes we feel that, the former Microsoft leader as Bill Gates does more than the whole Europe. This is unacceptable for Europeans. This is the contribution that we may have. I don't know now about the Brazilian specific role. Obviously in Africa, it has always been very important. what I was quite surprised, but it's not on health, but on my cyber background, is that for some reason, at least a few years ago, all cybersecurity in Brazil has been managed by the military, which is unusual. So I don't know if it's the same now, but I remember 4 or 5 years ago, I saw that it was something of the army and not of the civil. So I wonder if this can be something that we can discuss later. Thanks a lot.
Thank you, Marco Meyer, for your presentation and your comments. I don't know how we are going to manage with one screen and the 2 participants. If you could be both of you kind of together, yeah, that would facilitate.
A nice couple.
Yes, it's a nice couple, yeah. And we have to say that when CEBRI invited you, we actually didn't know that you were a couple, and we were very surprised. And of course, it's a great pleasure to have you both on board.
It was unclassified a very few weeks ago.
Well, I think that you have pinpointed 2 main issues. One concerns in the health diplomacy, in the health public sector and decision-making concerning the crisis of COVID, the lack of coordination among European countries. And concerning this first issue, I would like to ask you a question, and feel free to address either Valeria or Marco, whoever you prefer, in order to address this issue. What are the institutions that the communitary, the EU institutions that exist in the field of health that could have worked in a more proper way in order to advocate for a more coordinated action in the field of public health to fight against COVID-19? In many other public policies, in many other public policies, European Union countries do coordinate their efforts, right? And what has happened in this particular field of public health that has perhaps put some shortcomings on the way to a further and a better coordination? That is my first question. And the second one concerns the external dimension of the European Union's engagement. The European Union, at least here in Latin America, here in Brazil, it is very well known for its consideration as a normative power, as a power which builds norms, which defends values, including in the field of welfare, in the field of human rights, and human rights, of course, they also include the right to health. Right, and then my question is, in this external dimension of the European Union, you have developed quite a great deal on the EU-Africa relations. Would you have any insights and information that you could share with us concerning the EU and Latin American relations? What could you say about that dimension of the European Union external relations in the field of health too? Thank you.
Yeah, I think I'm going to start with your second question. The external dimension. First of all, let's consider that the bulk of the money of the EU budget is for internal policies, not for external policies. You just need to look at the multi-annual financial framework, and you will see that Global Europe is, the heading Global Europe is very small compared to the money that is spent internally for territorial cohesion, for agriculture, natural resources. So there's an imbalance between the internal and the external dimension. And when it comes then to also looking at where the money is spent, external policies, external money that is spent for other countries, then you see that most of the money was actually going to the ACP countries, which are the former colonies of the EU. So it's 78 countries. It's no longer now. There was a special heading, European Development Fund, which was for the APC, European Africa, Pacific and Caribbean countries, the bulk of the money was in that fund. For the first time now, that fund is being put inside the EU budget, but it was out of the EU budget because the member states wanted to have control over how that money was spent. So this is a second point that we need to keep into consideration. The bulk of these former colonies are actually in Africa. So obviously there was more money going to Africa. Latin America has never received that much money compared to what was going to Africa. Okay, so this is definitely something that we need to keep into consideration. The second point I want to make is that unfortunately, if you read the documents, EU documents, you always see that the EU is supporting human rights, that the EU is for the rule of law, that the EU is for this and that. But there is a gap between discourse and policy practice, a major gap. And I think that this is backfiring on the EU, because if you say that you are supporting human rights and then you're not doing it on the ground, obviously the partners with whom you're talking, you're speaking, they won't have sort of, they won't feel that they can be confident in what you're proposing, because there is this discourse. Even if you now read the document, the documents that were produced by the EU-Africa Summit, or the document that was produced by the meeting of foreign ministers in Kigali in October, you will see that these documents are full of wonderful words, but then it's not put into practice. And as I'm saying, this is backfiring. Unfortunately, you can even see it, that there is no coherence between the documents and what goes on. If you look at trade policies, if you look at the agreements with the countries in Africa, because there is a conditionality according to which you're supposed to cut off the agreements if the country doesn't respect human rights or so. But the majority of African countries do not respect. I can mention anyone, think of Gabon, Burkina Faso, whatever. In fact, and these agreements are not interrupted, they continue. So the point is that it would be much better for the EU to just stick to what it wants to actually do, rather than promise all these great things that then it doesn't keep up to. And the last thing about coordination, it's about how development cooperation evolved over time. Development cooperation, if you read, it's very interesting to read An Agenda for Change. It's a Commission document that was written in 2011. Why did the Commission issue a document entitled An Agenda for Change? Because it wanted to try and change things as they were. In that document, you read that the EU doesn't want to be the 28th donor, doesn't want to be the default donor. Why the 28th? That means after the 27 countries. In 2011, it was 27. Croatia wasn't still in, and UK was in. So the idea was the Commission was always the last wheel. It was always the member states that had priority because they were very jealous of foreign policy, and development cooperation goes hand in hand with foreign policy. So it has always been very difficult for the EU to be able to actually control and coordinate and guide development cooperation policies, despite of what is written in the Lisbon Treaty. Because in the Lisbon Treaty, it's the Commission that is supposed to coordinate. But how are you going to coordinate if the member states say it's my in my presentation, you will see that the priorities were not the same, did not correspond to the official discourse, because the official discourse was we want to put in practice the Millennium Development Goals. Millennium Development Goals means education, health. Look at where the money went. It went elsewhere. So there's a disconnect between discourse, narrative, and policy practice. And the disconnect is due to the fact that the member states are not willing to give up their responsibilities. That's why I said at the beginning of the presentation that perhaps the Ukrainian war is what will make us stick together for the first time in 70 years. Okay, I don't know if I have answered. And the last point is that the Commission has power dynamics that are crucial and that should not be overlooked. Whereby the different DGs have different resources. And DG Dev, which is now DG International Partnership, is a weak DG compared to DG Trade or other DGs. So there are internal fights, and the priorities are not always the ones that are set by the international partnership, Urpilainen, the Commissioner Urpilainen. And in this context, the European External Action Service is the newcomer in the game. So it is very difficult for the External Action Service to be able to control what the bureaucracy in the Commission actually wants. And as I said, the Commission doesn't speak with one voice. It speaks with as many voices as the number of the DGs. And the discourse is basically over the last years from the Juncker Commission, and now it's always investment, 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 private, public investment. And you don't go any, you're always, and even when you're saying that you actually want a partnership, is digitalization the real priority for Africa? Is green transition the real priority? Once again, it's the European priority, which is going to backfire on us. So my critical assessment is actually a critical assessment with a hope that the EU sooner or later will sort of really put in place policies that are mutually beneficial, because this is what I want to underline, mutually beneficial. I don't know if I've answered.
Thanks, Valeria. I don't know if Marco would like to add any note, because I still have other questions from YouTube. Perhaps I'll give you these questions and you can either Marco or Valeria try to answer to these questions. The first one is, what are the main strategies that can be adopted by EU countries in order to strengthen national healthcare systems outside of the European Union, the external dimension as we were talking about? And the second question coming from YouTube is, what lessons can, in your opinion, Latin American countries learn from the European experience in dealing with COVID-19?
Okay, so the first question is easy to answer, difficult as usual to implement. When we speak about health, we must not think to the UN, to the European Union, to the international organizations. You have to think about hospitals, health facilities, university of medicine, and so on. So you can easily create an horizontal, let's say, twinning, which is the easiest way, between, let's say, we live in Florence, Florence Hospital or Florence Health District, and as I can tell you this because we are volunteers there, as we can do with Tanzania, Dodoma Hospital, or Tanzania District, or Faculty of Medicine. So the first point is you have to change completely the approach. Doctors with doctors, nurse with nurse, medicine professor with medicine professor. So is what we call decentralized cooperation, which sometimes work at municipal level, but in the health system is very easy. There are in Tuscany some useful experience on that. So what we should have, not money going a huge project or in the back or wherever, but instead establishing direct twinnings. I don't know, you could have Florence with Tanzania, France, or some with Gambia, with a European plan of twinnings in the health sector, both with hospital and territorial health facility. So this is very easy to do. People would be engaged, but this is politically unuseful for the people that gain money on international cooperation. I'm not speaking of corruption, which is another point, but even, you know, understand, it's something that we have a village here where we are living that everyone is going down up and gives his skill to the African municipalities or health facility or whatever. So I mean, I would have a complete decentralized approach, obviously planned by the European Union, in order not to have the same countries in the same place and so on. This is our clear idea that you will find in the book. We did a chapter together on that. The second question I forgot in the moment, sorry.
What are the main lessons learned for Latin American countries based on the EU's experience?
Can I just add one point? There is a major issue about brain drain currently, which means that doctors and nurses from Africa, not only from Africa, but from developing countries, are actually taken away by the developed world, in the sense that they go and study in these countries and then they never go back. My suggestion, I have a very clear policy suggestion, but I even proposed this to the ILO something like 10 years ago, but it hasn't gone anywhere. You need to have agreements with Italian universities or European universities to train the people, be it nurses or doctors, but there have to be agreements with the countries of origin. What kind of agreements? Agreements that the country is sending over the person to study in medicine, whatever, become a doctor, a specialist, but then the country of origin takes responsibility for hiring back that person in the national system, because this last part is never there. Even the Erasmus program is just sending the people over to study in our universities, and once they're here, they don't want to go back because obviously the salaries are higher. So what I'm suggesting is there has to be this kind of an agreement. It's sort of circular mobility, but it's circular mobility not for the labor market, but for education.
Okay, so on the second question, I don't know much, to tell you the truth, of what happened in Brazil and in South America. So I will tell you more what I know about China and Europe and Italy especially. But as Italy was so badly affected, as you know, from the COVID, probably some of your insight, of my insight, may be useful. So the first question is about early warning, freedom of speech, and democracy, which sounds a bit strange, but it's important. As far as I know, the first case, clinical case in a Chinese hospital has been on the 17th of November, 2019. Probably it was, there are probably things before that, but that you can read on South Morning Post, Hong Kong. I mean, so I don't think they will lie. Why? And the source is government. So you must consider that on the 31st of December 2019, so we have 6 weeks later, the Wuhan Health Commission wrote to Geneva World Health Organization with two statements. As far as we know, there is no risk of human-to-human transmission, and for the the doctors and the nurses and the people working in hospital, there are no specific risk. 6 weeks. The China government decided about the tough measure that they have taken on the 23rd of January. So we have a gap, a very long gap, during which millions of people have gone through one airport, Chinese or whatever, I mean, of all the world. I don't know if it's 7, 6, 8 million of people. And this shows how early warning is important. Why do I say it's linked to freedom of speech and expression? Because, as you all know, the doctor, I can't remember his name now, at the start, after 10 days that there was this emergency in the Wuhan hospital, on the WeChat, which is the Chinese WhatsApp, let's say, just to understand, began to write to his colleagues, and the police stopped him and was very angry. So one key point of what we call early warning, a precondition is freedom of speech, because perhaps it's a rumor, perhaps it's you need fact checking, but if you can't express anything, this is very bad for. The second point is bureaucracy, because President Xi of China has stated that he has known about all this what was going on in Wuhan on, I think, the 7th or 8th of January. And I think he told the truth, because in a bureaucratic system, before something goes to the leader, takes too long time. So this is one lesson. This also applies to Trump, to Italian government. I mean, I'm speaking of China because it's where it started. The second point is the question of corruption, which is not always a legal problem, but it's a behavior. Let's say I speak of corruption in terms of behavior, not that you have to go to prison or you are condemned. It's a question of mindset before can be sometimes criminal, sometimes not. What is the point that I want to stress? That when you choose a vaccine, you can't consider and choose that vaccine because you hope that the shares in the financial markets will go up or down. But you have to decide if the vaccine is really helpful or not. Unfortunately, there are some important public goods in the world that are not considered for the effectiveness of their nature, but for what they can do in terms of financial markets, performance, or even simply support to politicians. I know that there was in Brazil a Sinovac experiment. I was following that for 2 or 3 months. I don't know the end of the story, but there is a very wrong, my wife would be even more clear on that, the so-called Washington Consensus, which was copied in their interest by China and Russia too, has done a very negative impact on the people understanding of how the world works, in the sense that markets are important, but are only one of the factors. And if we don't consider the importance of the state, the public good, the international cooperation, and we leave only to the market, the result will be very negative. In 1999, and I am ending my statement and my answer, there was a very important summit, one in Washington and one in Florence, in our town, with the big leftist leader of the world, like Clinton, Blair, D'Alema, and so on. And at the second one, I think in Florence, also the president of Brazil was invited. I can't remember the name. Cardoso, was it? Okay. And the only person that said, look, pay attention to this well-fashioned, market-oriented everything, because places like Brazil must consider that public good is more important than a short-term performance in the market.
Thank you so much, Marco Maier and Valeria Farjon. Unfortunately, I know that the debate is very rich. There are many questions still to be asked and answered, but we will have to conclude this exchange with you with a great note of thanks And I'm going to give the floor back to Ambassador Ibanez and then to Director Pio Borges to make the concluding remarks.
Thank you very much. Really, Carlos, it was a very rich debate. Perhaps, if I may, some comments on the very rich interventions of Valeria and Marco. That, of course, they are the true expert, be it in health of in Africa. Even I started my own career also in Africa, particularly in Tanzania, a country that Marco has referred to. Yes, it's true that the EU cooperation has changed and needs to change looking to the future. There are many areas in which we have to learn, and the reflection of Valeria are really very, very helpful. I would say that one of the changes already started with the change of the name. As you know, before the DG was called Development, which was more the idea that we knew what the African or Asian or Latin American countries need to do, so they need to develop, and now we have called it Partnership, and the idea of partnership is the idea that is a process that we do with them. So it is, of course, important to try to work with them. Sometimes we get the right proposals from their side. Sometimes we do not like what they propose to us, but a partnership is to work with them. Of course, we have values, and I think Marco has very much clearly mentioned some of these values. Will it be with relation with Asia, China, of course, also with the African countries, and we have to develop on this point of view. I would say that yes, I completely agree that the COVID situation was a challenge inside Europe. First of all, we have to accept in our model, and we have to change a lot of things. For example, we did for the first time as European, we were able to agree that to put the money together for the vaccine, something in the past we were not able to do. Each country was developing their own system, and this time we were able to put together the money for giving the Commission the role to negotiate with the pharmaceuticals, and after the distribution of the vaccine was done at the central level, of course, taking into account. So there are things in which I will say we are always a project that we have to keep changing, but there are things, lessons that we learn. And I think very particularly on what Valeria has been mentioning, that we do have to invest more on the health system, especially from Africa. I completely agree. It is one of the conclusions of this 7th summit of Africa, EU, where there is a very clear message saying that we are going to, and I'm quoting what the statement says, support for initiatives related to pandemic preparedness, health security, and equitable access to essential services. So some of the ideas that Valeria was mentioning, the fact that we do not have only to take care of the leaders being able to go to Europe to take health, the idea of this equitable access is precisely going on this line. So I really think that the discussion has been very, very fruitful. I would say that in one of the things that I think Marco and also Valeria referred to, what we can do together, which I think this debate is always important, what we can do together, the Latin American countries and the EU, and I would say particularly in my case, Brazil, because it's the place where I am an ambassador. I would like to say that in the last visit of our High Representative here to Brazil last November, we signed a very important agreement, which is an agreement on trilateral cooperation. The idea is Brazil, which has, of course, a lot of experience in cooperation and South-South cooperation, which is something which is always very important, and particularly, I would say, with Africa, but not only, because they also do cooperation with some Central American countries and other Latin American countries. From now on, we will be able to define joint projects, so EU and Brazil going together to another country to develop, of course, with the agreement of this third country, which has to be like this. And there are already some ideas for Central America. There are also some ideas in Africa, particularly in Mozambique. So going together on this direction, which I think is going to work very, very well. So thank you very much. It was really a very fruitful discussion. And lately, perhaps on BRICS and I would say on the relation with the strategic relation between EU, but also take into account the rivalry with US and China, because I think we had a question going on this direction. What does it mean for us the strategic autonomy in the relation with US and China? I think it was China has been qualified from the EU in three lines. The first one is a negotiator partner, so we are really looking forward to keep working with China at international level. For example, now we are going to have the COP on biodiversity, which is going to take place in China, and we do want to cooperate with China. The second thing is that China is also an economic competitor, so we have to get ready for this competition. And in this part of the world, I will say in Latin America, for example, we do count very much on being able to develop our EU-Mercosur Association Agreement precisely to be better prepared to face this competition, which is a legitimate competition of the Chinese wanting to be more present in Latin America. But us, as European, we want to keep this leadership we have been having from the trade in the past. Now, not so much. The Chinese have been able to surpass us on trade, but for example, on investment, we are still with a big difference, the first investors in Latin America and very particularly in Brazil. But also, and this is the third element, which is of course important, we also qualify China as a systemic rival. So it's we do have, and I think this Marco alluded to that. We do have differences on the way we value the relation and the system that the Chinese have, and this is something that we change. If we compare China with the US, looking from the EU point of view, which of course is our point of view, I will say the two first conditions, negotiator partner and economic competitor, are also there. But yes, the difference with the US is that, of course, we do not see them as systemic rival, but just the opposite. We really think that we share values with them, and that's why in a crisis like the one of Ukraine and Russia, we are very much on the side of the US, and we are cooperating very strongly on the sanctions, and we are imposing on Russia, and also on the international relations. So I think these are the difference in our relation, let's say, with China and the US. We're trying to answer one question that has been put by the audience. Thank you very much, and I give the floor to my good friend, Pio.
Well, I would like to thank Marco and Valeria for excellent discussion, Carlos for moderating this event, which shows health as the first topic of discussion in this program for obvious reasons. COVID. Of course, we are having to permanently readdress our programs, especially now after the war in Ukraine. But we firmly believe that the European Union can have should have an important role in many issues in geopolitics. To begin with, the diplomatic, when the things started to settle down, I hope that Europe will take the driving seat in leading the peace negotiations with Russia and Ukraine. Second, I think it was mentioned here by Carlos, I think there's an important issue which is regulating the tech industries. I don't think the US, we can expect from the US the leadership in doing that, and I surely hope that Europe could take a strong role in this issue that is so important. China is doing that in their own way, but I think the West has to do it differently, and Europe could have an important role in this. Also, as Ignacio mentioned, the avoiding and mediating this antagonism between the US and China. Brazil, as you may know, trade with China is larger than the US, Europe, and Mercosur together. So, and it's not only Brazil, it's hundreds of countries in the world, including the Ukraine, have China as the major trade partner. So dealing with China in a reasonable way and avoiding this new Cold War that the drums of war permanently are making noise in the press, especially in the US, I think Europe can have a reasonable and a sensible role in all these issues. So that's why this vision of a multipolar world in which Europe and Latin America could also have a word is very important to us. So I thank you, Ignacio. Thank you again, Marco, Valeria, Carlos, for this wonderful meeting, and I hope to see you all soon. Thank you.
Thank you very much for inviting us. Thank you and bye-bye.
It has been an honor. Thank you very much for us.
Thank you, Marco. Thank you, Valeria.